This is a brief description of a setup and findings from the article Nasal Sound Pressure as Objective Verification of Implant in Active Transcutaneous Bone Conduction Devices. Bone conduction devices are hearing aids intended mainly for patients with a hearing impairment originating in the outer or the middle ear. Active transcutaneous bone conduction devices consist of an external audio processor that picks up the sound and transmits the signal over the skin via an induction link to the implanted unit. In the implant, a transducer provides vibrations into the bone. The bone conduction implant, the BCI, is a new active transcutaneous bone conduction device in a clinical trial. It is implanted in 16 patients, 13 of which are included in the current study. The nasal sound pressure, the NSP, is an objective measure. A probe tube through an earplug is inserted into the nostril. The preamplifier to the microphone is attached somewhere close to the nose, and the microphone is attached to the probe tube to measure the sound pressure in the nostril. Electrical stimulation of the implant through a custom-made audio processor should cause the implant to provide vibrations throughout the skull bone. These can be heard as sound, as it radiates from the skull into the surrounding air. It also radiates into all cavities of the skull, and the nasal cavity is one of them. Hence, the sound pressure could be measured in the nostrils, giving an objective verification that the implant is functioning. The patient is holding the breath during the measurement, that takes about 20 seconds. The primary aim of the study was to validate the NSP measurement as objective verification of the implant's functionality by using it in a clinical study of a BCI. Also to investigate inter- and intra-subject variability, and to investigate the stability of a transmission over time. The NSP during surgery was above the noise floor for most patients within the frequency interval 0.4 to 5 kHz. Showing NSP values for expected normal transmission of a functioning implant. Inter-subject comparison showed large variability, as you can see to the left. The follow-up results showed only minor variability within each subject. Shown to the right, further investigation of a change over time showed that the NSP was stable over time. To verify the implant functionality is important during the surgery to know that the implant is functioning after sterilization and handling during the surgery before closing the wound. The NSP method is considered applicable to verify the implant function during and after surgery. Such a method is important for implantable devices, but should be simplified and clinically adapted. Large variations between subjects were found, as well as smaller variability in intra-subject comparisons. As the NSP was found not to change significantly over time, stable transmission to bone and implant functionality was indicated. Thank you for watching. Please read our article for further details on the study.